You guys have heard about the glow up facelift, the ponytail facelift. It seems like there's so much going on with celebrities, TikTok influencers having plastic surgery really young. You guys, we mean like facelifts in your 30s and 40s. We want to break down, what does this mean? Is this the right thing for you? And what do you have to be cautious about? I'm Dr. Ashley Amalfi, board certified plastic surgeon and co host here at Lipstick and Lipo, your unfiltered guide to plastic surgery. I'm here with my co host, Dr. Smita Ramanathan. Welcome, Smita.
Hi, Ashley. How are you? Hi,
I'm so
guys.
good. Talking about there's so much celebrity plastic surgery lately, guys. You guys are giving us endless stuff to break down and talk about. And everyone's face is looking pretty spectacular, even the youngins.
Yeah, exactly. I mean, listen, you look at Lindsay Lohan, Anne Hathaway, like who knows what these celebrities have done, but they have all of a sudden reappeared and look beautiful, right?
More than ever.
They're
Like,
doing something. It's not the olive oil or
yeah, yes.
celebrities seem to love olive oil, but no, it's not that, guys.
I mean, I love olive oil too, but it has nothing to do with how young these people look,
Yeah.
right? And they're doing lots of little stuff, which is not necessarily bad, you guys. You just have to remember that there's like long term consequences to all of this. And so if you're doing more surgical stuff younger, that's okay, but it doesn't necessarily mean you're not going to need it when you're more middle aged. And so you want to be doing things right. Talk about credentialing, Smita. Like, everyone thinks this is like no big deal and you can kind of go wherever. And why would that be a bad idea?
Yeah, I mean,
Yeah.
I think it's such a bad idea in my mind, because I
We know
it's
why, but we got to tell you guys. Yeah.
I mean, listen, like to begin with, right? I think when we start calling things the ponytail facelift and, putting these like marketing terms on these surgical procedures and making them seem like they're not actually a big deal
Yeah.
anymore. And I think that's the problem because it's still surgery. There's still a scalpel. There's still a lot of damage that can occur if it's not done in the right hands. And so that's
Yeah.
why it's so important to research your plastic surgeon to make sure number one, you're going to a board certified plastic surgeon by the American Board of Plastic Surgery. That is literally the only one accredited real board. So, it's easy to get lost in on people's websites and everyone's credentialed, right? But there's only one board that credentials and certifies us as board certified plastic surgeons. So you want to make sure that you're at least going to someone who has that credential, but then also is doing these procedures in their practice often, right? There's a lot of anatomy, a lot of intricacies that you have to understand as a facelift surgeon, no matter how light you want to make it, right?
Yeah, that's real stuff. I mean, it's real surgery and real risk. And I think that's kind of the point here is like, you don't want to be, going to just whoever took a course and can do this like new trademarked name. This is real surgery, and you want to make sure that you're doing it right and that you're not causing harm. But we're all for doing everything you can when you're younger so that you age really gracefully. And we want you guys to do that with the right surgeon, and that's not just surgery. There are some small surgeries in your 30s and 40s that can be really useful, but also like toxin fillers. Like, you guys should be on a regimen including skincare that's building collagen, that's keeping the volume in your face, that's preventing those deep lines and wrinkles from getting to a point where we can't fix them. That is what we should be focusing on in our 30s and 40s.
Yeah, exactly. I mean, I call them tweakments, right? It's like all
Oh, I
these small
love that.
things that you start. I mean, we really start to see a loss in collagen and elastin in our late 20s, right? Unfortunately, it's a lot
Isn't it
earlier
wild?
when we start actually thinking about it, right? So we want to start these little things like skincare, start a retinol. Of course, you should be using sunscreen since, for decades at this point. But
Yeah.
starting with skincare, adding some baby Botox, even a little bit of filler as we start to lose a little bit of volume. Just keep it really mild. And, you're just sort of doing these small little things over the course of years that will just allow you to age gracefully, right? And then once we get a little bit older, and sometimes the structural aging does happen in our late 30s, early 40s. And at that point, then you can start thinking about some of these facelift or more surgical procedures. But again, you talk to us, right? I mean,
Yeah.
that's what we're there for, because what we don't want to do is, um, you know, add too much filler or do, God forbid, people are doing like threads and all this stuff, and some of them are not dissolvable threads. Uh,
Just don't.
just don't. Or, they're using fillers that just leave a lot of scar tissue. And that could be a real detriment in the future, when you really have significant aging. So, just,
Little by little, like if you have like a great surgeon that you're going to, you're doing Botox or Dysport on a regular basis. Every time you go, just ask your doc, is there anything else we should tweak or work on? And then if you're just doing little things, throughout the year as you age, we're going to tackle all the little things as they come up, and you're going to just age really gracefully without all of a sudden walking out and looking like a totally different person. That is not what we're all about. That's not our aesthetic. And we know you guys don't want that either. So that consistency is key, just like you guys are going to your dentist 2 or 3 times a year for cleanings, come to us and then we will kind of keep things on track and address things as we need them. And at some point, yeah, surgery is the right option. And you don't want to spin your wheels with just Botox and filler, but you want to make sure you're going to the right person and that it's not going to prevent you from having bigger surgeries down the road that you might need to address aging. So you always want to be thinking not just of the now, but of what comes next. So we would love to hear from you guys in the comment. Like, tell us, when did you start Botox? When did you have your first surgery? And I would love to know what that timeline looks like for all of you, because I know this next generation, you guys are starting younger in a good way. And I can't wait to see you guys when you're little old ladies, because you already are on top of it. But that's what I'd love to hear from you guys.
I know, I love that. And like, what's your favorite, right? Because I think even there's skin resurfacing. We didn't even talk about that, but
I
like
know.
microneedling, all of that just makes such a huge difference in really building a strong foundation, right? And so
Yep.
facelift in someone who's 45 or 50 that has been doing years of good skincare, Botox fillers, they're going to have such a better result compared
Oh
to
yeah.
someone who touched their face, never worn sunscreen, just because the foundation is different. So leave your comments. We want to know what you've done, what tips you have. And don't forget to subscribe, follow us, Lipstick and Lipo. We are all over the place, guys. We're on Spotify, YouTube, Apple Podcasts. So we'll see you guys next week.
All
Ready?
right. See you guys. Thanks, Smita.
Bye.
Bye.